Hello, I'm Congressman Joe Barton. I'm the senior Republican on the Energy and Commerce Committee, which is the committee of jurisdiction for most of the healthcare debate. My congressional district is down in Texas, in Arlington, Texas, and in the rural counties between Dallas, Fort Worth, and Houston. I have just come from listening to President Obama in his joint session of Congress speech to the Congress and the nation about health care. My initial reaction is the President has either not read his own bill or he's apparently written a brand new bill that we haven't seen yet. Because what he discussed this evening is not the bill that we spent 2 weeks marking up in the Energy and Commerce Committee in late July and early August. So many things that he said just don't reflect what is in his own bill. Let me give you an example. He said that the plan that he was announcing this evening would not add one dime to the deficit. Well, the bill that we marked up in the Energy and Commerce Committee is at a minimum going to cost an additional $239 billion over 10 years, and there are some estimates, even at the Congressional Budget Office, that that number could go as high as $1.6 trillion over 10 years in additional spending. So that's one area the President obviously hasn't looked at the bill that came out of the Energy and Commerce Committee, or he doesn't, or he's got a bill that we haven't seen yet. He also said that no illegal immigrant would get health insurance or health coverage under his bill. Well, in the Energy and Commerce Committee bill, again, there is a provision that says only citizens get the benefits, but there is no enforcement mechanism to check that you are a citizen when you apply for a benefit. We, the Republicans, Congressman Nathan Deal of Georgia and myself and several others, offered an amendment to put real enforcement mechanisms into the bill so that you could actually enforce that only citizens got these benefits. Every Democrat on the committee, at least I think every Democrat on the committee, voted against the enforcement mechanism. So if the President means what he says this evening, he should support an enforcement provision that would guarantee that only U.S. citizens got these benefits. The President said that if you have the health insurance that you like, you can keep it. Again, he's not really looked at the bill that was marked up in the Energy and Commerce Committee, because that bill freezes every existing private plan in terms of number of people in the plan and benefits offered by the plan at date of enactment. And it gives a new bureaucracy, the Health Choices Administration, the ability to set what the benefits are going to be. There's also a provision in the legislation that creates a Health Benefits Advisory Commission that recommends to the Health Choices Administration what the benefits should be. There's a provision in the bill that says that the premiums charged have to be, the employer has to pay 72.5% of the premium for the insurance package that's offered. Now, if you're a small businessman or woman and you're providing insurance coverage, you have what he called, if a company doesn't provide health insurance, they have to chip in. Well, what that really is a penalty and a tax in the bill that if you choose not to offer coverage because you can't pay the 72.5% of the premium of these mandated benefits, you can pay a penalty, which is 8% of the wages, 8% of the salary of your employees. That would mean that somebody making $40,000 a year, 8% of that's $3,200. If the mandated benefit that comes through the Health Choices Administration is, say, $12,000 and the employer has to pay 72.5% of it, well, that's about $8,000 or $9,000. So you would stop providing the health insurance that you're currently providing, you'd pay the tax penalty per employee, and you'd come out ahead from a business perspective. So when the President says if you like the insurance that you have, you'll get to keep it, again, I don't think he's read his bill, because in most cases, in a lot of cases, and independent objectives have said that it could be as many as 114 million American citizens would lose the insurance that they currently have today. So just kind of in summary, most of what the President says in general, I can support. When he's talking in general terms about portability and transferability and more accountability, myself and almost every Republican is for that. But when you really get into the specifics of what's in the legislation, all the new bureaucracies, all the new mandates, all the new taxes, it's much more difficult to say that I support that. In fact, I don't support it. I oppose it. So I'm going to watch in the next day or two, see if the president actually puts on paper a new legislative proposal that does what he said in the House chamber this evening. If it's just the same old bill that we've already marked up in committee, I'm going to oppose it, and I think the American people will oppose it, and ultimately I think the Congress will reject it. The president gave a reasonably good talk in terms of platitudes, but in terms of substantive policy, again, he's not looked at the bill that came out of the Energy and Commerce Committee, or he's written a brand new bill that nobody's seen yet.